Hi, my name is Trena, and this is Duke. He's going to help me demonstrate vital signs on a horse. The first thing to do when you're checking for vital signs is you want to see the overall look of the horse. You want the horse to have a nice, shiny, healthy coat. You want a bright eye. You want the horse to have a perky facial expression, just to overall look happy and healthy. If you've got any signs that the horse has got a dull coat, maybe droopy eyes or a glassy eye, or droopy ears or a glassy eye, you should definitely do some checks to see if your horse is feeling okay. The first thing I'm going to start with is checking the horse's gum color. I do. You want to make sure your horse knows you're coming and you're polite. You check his lip. You want a nice healthy pink. His lips look nice and moist. And you can check on his eye, which he is not really feeling right now. The next thing you should do is do a capillary refill test, which would be to hold up the lip, press your finger against the gums, and it should become white, and then the capillaries should refill with blood within 1 to 2 seconds. And this is a sign of your horse's hydration. And he popped back pretty quick within 1 to 2 seconds. Much better. There we go. Good boy. Okay, so to check my horse's pulse rate, I would check the maxillary vein right under the jaw here. You should check for about 15 seconds and then multiply by 4, and the average beats per minute should be between 32 to 44 beats per minute. So I'm going to check. I've got a little stopwatch going. Let me find it. And then I'm going to start. And I got 10. So multiplied, that is 40, which is completely within the average range for his beats per minute. The next place you can check your horse's pulse is down on the inside of his foreleg. You should allow your horse to know that you're heading down. You want them to be aware of where you're going so you're safe at all times. And you can find the radial pulse just under the knee on the inside of that front leg. Okay, so once you've found your radial pulse, you should again count for my 15 seconds, which I will start now. And I also got 10 down there, so that means 40 again. Another pulse that your horse could have, but you should not have, is the digital pulse, would be on the back of the fetlock. A digital pulse will indicate that there is inflammation in the foot, which is a bad sign, so you may have some problems going on down there. The next place you should check to make sure your horse is still nice and healthy is gut sounds. There are 2 quadrants on each side of the horse, so there's 4 quadrants in all. There is a high quadrant and a lower quadrant. I like to check my quadrants with my head facing backwards so you can have an idea if there is a leg coming at you. You have a bit of warning then. You should have a lovely rumbling, not constant. If you have a constant whooshing noise, then you have hypermotility, which is too much moving through the digestive system, but you should have a nice rumble and a little bit of quiet and then another nice rumble. So I'm going to go ahead and check Duke on this side first, and we'll go ahead and listen. Pretty good rumble right there. And the whole time I'm petting him to make sure he knows that I'm there, so I'm staying nice and safe near his back end. Heard a good gurgly rumble on that side, and then I'm going to go check his other side. I'm going to have him, good boy. Alright, checking the top quadrant on this side. Good healthy gurgle right there. The lower one. right away a really good gurgly rumble right there. So the next place I'm going to check for my horse's health is his temperature. Your horse's temperature is a big part of their health. So I want to make sure my horse knows I'm back here. You should thoroughly lubricate with petroleum jelly a digital thermometer if that's what you're going to use. And then you should let your horse know that you're back here. Give him a little bit of warning. Upside down. And then press gently against the walls of the rectum. That way you actually get the temperature of the... That's not accurate. And then begin your thermometer. And my horse has a completely normal temperature of 99.4, which is pretty average. 100.4 is completely, that's the average temperature, whereas 99.4 to 101.4.
Go.
Another way to take your horse's temperature would be a glass thermometer, which you should have a clip attached to. You should also thoroughly lubricate it with a petroleum jelly before insertion, and you should shake it down. That way all the mercury is at the bottom of it, so it...
You're fine. No, you're fine. Go.
So your horse's temperature should be between 99.5 to 101.5, 100.4 being the most average temperature. When we did with the digital thermometer, Duke had a temperature of 100.4.
Mm-hmm.
So another way to check my horse's temperature would be with a glass or mercury thermometer, which I would lubricate with the petroleum jelly, just like the digital. I would insert, and I would have a clip attached to the thermometer, which I would attach to his tail so the thermometer doesn't get lost. And I would, prior to insertion, I would shake it down so all of the mercury will be ready to take a temperature. So the next place to check your horse's health would be his heart rate, would be down under his elbow here. I like to check with a stethoscope. Your heart rate should be the same as your pulse, so it should be 32 to 44 beats per minute. I'm going to go ahead and check his. I think I've got it now, so I'm going to start timing myself. And I got 11 that time, and 11 times 4 is 44. So that is 1 beat higher than I got in the maxillary and the radial, but it is still absolutely normal. It is completely normal. So the next thing I'm going to do to check my horse's health is check his respiration rate. The first place you can check his respiration, but is not accurate, would be his nose, the breath's coming out of his nose. But horses tend to be fidgety creatures, particularly Duke right now. He'd like his dinner. So, but you could feel it coming out. But if your horse is fidgeting, it's not going to be very accurate. A better place to check your horse's respiration rate would be at the flank, where you can stand parallel to your horse and watch as the flank goes in and out with each breath. Your horse should have 8 to 16 breaths per minute. So you should stand here for about 30 seconds, and then you can multiply by 2. I'm going to have my videographer time me for this one. Alright, I'm ready, and go please.
Stop.
Alright, I got exactly 5 breaths on that one. So 5 times 2 would be 10, which is completely within the normal breathing rate, respiratory rate of the horse.